So, thank you, Bree. Welcome, everyone. Today's webinar is from the Health Research Institute's Knowledge Synthesis Center. And I'm Trina Fife. I am the interim co-lead for the Health Research Institute and the University Librarian at UNBC. And of course, this is can't be done without Leanna Garraway, who is the manager of the Health Research Institute, Dr. Sarah Gray, who is the co-lead for the HRI and professor with a Division of Medical Sciences. Bree, who I forgot to put on here, Bree Loeffler, who is kindly hosting this for us today, and Terri McKellar, who will be speaking, who's the Knowledge Synthesis Center librarian. So, and just to acknowledge that we are meeting today, or presenting this webinar from the unceded traditional territory of the Lheidli T'enneh. And I think the chat is enabled. So perhaps if anyone is coming to us from somewhere else and would like to put that in the chat, that would be fantastic. So I'm just going to open this up with a few things. Here on the screen, I've just put the current goals of the Knowledge Synthesis Center, which was established officially in 2019. And it really is uh, to support researchers at UNBC and within our partnership partners that we have in doing knowledge synthesis work. And really it's meant to be contextualized in rural and northern, but we've sort of opened that up a bit more. And Terry's going to talk more about sort of what we do and how we support faculty and other researchers in this process. But since 2019, we have done, by my rough estimate and count, 42 projects and currently supporting 7. So we've done quite a bit of work in with knowledge synthesis methodologies. I just wanted to give you a few examples of the kinds of projects that have come through the Knowledge Synthesis Center and some of the outputs that have also been as a result of these projects. So I've just listed 3 here, and you can see that they've all had academic leads and then partners with other institutions. So the first one, Dr. Chelsea Pelletier, led with BC Wildfire Services, and the output was a publication that was published in Systematic Reviews. We have another one from Martha McLeod, who I should acknowledge spearheaded this and created the Knowledge Synthesis Center at UNBC, and so there's been a lot of great work coming out of here because of Martha's leadership in this area. And so she had partnered with Northern Health. This is another example of a hermeneutics and implementation scoping review, which was a new model or new approach to a method for a scoping review. And then we have other kinds of, I would say, outputs or projects, like the third one, which was led by Dr. Henry Harder in partnership with Northern Health, the school district, and the Ministry of Child and Family Development. And this one was not like your traditional, I would say, knowledge synthesis that was ended up being published in an academic journal, but had some created reports out of this that was then implemented and utilized by the partners. Another one, just to give you an example of a project and output that actually started prior to the official development of the Knowledge Synthesis Center, but then became supported by the Knowledge Synthesis Center over time, was the work done by our a previous dean and faculty member at UNBC, Dr. Shannon Wagner, who was funded by WorkSafe BC and had an international team pulled together to conduct four different systematic reviews, which to this date has led to 11 articles plus one that's in progress. And actually, just the other day, um, with my previous involvement with the Knowledge Synthesis Center as a librarian, updated the most recent search to help address any new material that had come out since the last time we updated it to satisfy the reviewers of that current paper. So there's lots of great work that's happening through the Knowledge Synthesis Center. And here's another one I just wanted to also demonstrate that from the work of the KS Center, we also have, we can identify the impact of that work. So here's one that again, Dr. Chelsea Pelletier had worked with the Knowledge Synthesis Center around physical literacy in the context of health. And this one, I always keep getting in my research gate, I keep getting, notifications that someone has read it or someone has cited it. And so it's having a big impact. And the reason I'm showing you this, because librarians don't love metrics. However, but they do have a place, and this is just showing that this kind of work is really important and does lead to often the development of other projects around a particular topic. So, that being said, I am going to stop here and then I'm going to turn it over to Terri McKellar, who again is our knowledge synthesis librarian, who joined us in May of this year. And we're really excited to have Terri here. Terri, this is a joint position between the Health Research Institute and the library. So it's part funded by both, and the health authority, or sorry, and the funding on the HRI side comes from the partners as well. So it's partner funded and UNBC funded, and we're really excited with this model. And Terri's been working with us, and yeah, I'm going to turn it over to Terri to talk more, and I can stop talking and really tell you what we do. Thanks, Terri.
Thank you, Trina. Just bear with me while I start sharing my screen here. Hopefully that all functions okay. All right. So just moving things around. You should now be looking at a full screen of my slides. And I'm just going to move on through here. So Trina already generously did the land acknowledgement, but I would just like to highlight that I am actually presenting from the shared traditional, ancestral, and unceded territories of the Tsawwassen, Musqueam, and Coast Salish peoples, and very grateful to be doing so on this very foggy, chilly morning. Now afternoon, but it was a foggy, chilly morning. So I want to start by also thanking Bree Loeffler and Leanna Garraway for setting this up so I can speak to you today, and also for all of their work at the HRI. They really do run the day-to-day there. The topic today is an overview of the knowledge synthesis process. I'm going to be speaking about these projects kind of generally, but there are differences between review types, and I'll mention those throughout the presentation, but we're going to be keeping it pretty broad. Aside from scoping, systematic, and rapid reviews, we're going to include integrative reviews in this as well, because they are also a large knowledge synthesis project, and they're commonly done by nursing and in healthcare. This is the agenda for the presentation. As I stated, there will be an overview of the knowledge synthesis process, what it is and what it isn't. I also want to highlight throughout some opportunities for support for your projects from the Knowledge Synthesis Center. There's a few different ways we can help at different stages. And I will also highlight some resources that may be helpful and some opportunities and ways to connect. So. So we call this tiers of service. We offer different levels of service or different access points. At this point, we've really tried to avoid being overly restrictive or prescriptive with it being like you get 1 hour or you get 3 hours or something like that. So there's no real hard and fast rules here, but generally, we can offer some general support around the process, including, and this is quite common, access to Distiller, which is an evidence synthesis software, and we'll talk a little bit more about that later. We can potentially offer research assistant support in the event that you don't want to hire your own research assistant permanently for the whole project. Perhaps you just need like 10 hours of an extra person to help out, and we can kind of help facilitate that. We have consultation as well. So again, various levels from, just some introductory guidance as to what the process is, or maybe you need a little more ongoing support throughout the process with, like Katrina had mentioned about updating reviews or any of those kind of pain points that come up. Sometimes you need just a little bit of extra support. And then there's also the full collaboration model. And this is really a lot of what we've done in the past. So it's that full-on shared authorship. The librarian is really collaborating and writing that search strategy in connection with an academic lead, and then fully doing all of the searches, running all of that. And then when it comes time for writing the article, we're writing the methods section, or at least drafting the methods section and providing all of the documentation around the methods. So it's a larger collaboration there. With any of these levels, as the PI, the principal investigator, you're still the driver of the project. We're very collaborative, but it's in a supportive way. This isn't something that we're like taking over and making just ours. It's collaboration and shared responsibility. Excuse me. So who can access the Knowledge Services Center? So these supports are intended for faculty-led projects. Often there's funding involved and in place to pay for things like Distiller and for research assistance time. However, we do have some considerations for students, or some opportunities for students. But I would just emphasize, if you're writing your master's thesis, for example, and need support, then I really want you to consider accessing the existing guidance and help that is available through the library. We have subject liaison librarians who can support you in understanding how to search databases and maybe, building a search strategy. Or maybe you just need a little bit of guidance or help in that, and they can really assist you with that. And you may be wondering at this point, if I am your subject librarian and you're like, well, you're saying I need to access someone else and I can't use this. I wear two hats, so I sit in both places, as Trina mentioned. So it might just be that you're reaching out to me as the UNBC librarian and not the Knowledge Services Center librarian. And there's no real differentiation between that, truthfully, because it's the same email address. It's just my email. So it's fine. And I can help you, with building your search, especially if you happen to be in nursing. I can help you with building your search and moving forward with that. Or guiding you in that process. Or if you really need to understand how to turn a scoping review into a one-person project and like what kind of changes do you have to make so that you could do that for your master's project, I can assist you with that. The library website has amazing resources as well to help students and faculty. There's a lot of resources around knowledge synthesis. There's a detailed knowledge synthesis guide. I wrote it, so if there's something in it that isn't clear, please reach out to me so I can make it better for you. Other things within the HRI, we have student representatives on the Leadership Council. So it's Jonathan, Jake, and Nuzia. We also have an amazing portal to connect people, and it's called HRI Connect. And I am going to address that a little bit later and then a couple times throughout the presentation, and there'll be a QR code and whatnot. I just really want to emphasize that it's a great resource and something I want you to look into. We are seeking a pool, or we're moving towards seeking a small pool of grad students who are interested in working on these projects on a kind of a contract hourly basis. We're not quite there yet, but having your information in that portal makes it easy for us and researchers to find you. So I do strongly recommend doing that. But getting into it. So getting into knowledge synthesis and the process. This here, what you're seeing, this is kind of the formula. This is the methodology for evidence synthesis. It's just like any other science experiment, like lab work. It's intended to be documented for transparency and reproducibility. It is rigorous and it is time consuming. Rapid reviews take weeks to months, and they are the smallest of projects in this category. There are adjustments that are made to rigor, basically, so that it can be accomplished in a shorter period of time, but you still have that, you still have to be transparent and reproducible. Scoping, systematic, integrative reviews, these take 12 months to over 2 years, depending on the scope of them. So I really want you to keep that in mind when you're going to be doing a project like this, that it is big. It's big and it's a lot of work. And with respect to the hours involved, the University of North Carolina at Chapel Hill Libraries put together averages of hours involved in various stages of this process. And this is for scoping reviews and systematic reviews. I almost feel these are underreported, but they are averages. So there are some that are greater and some that are smaller. But if you put all of these together and give someone, 7 to 8 hours a day, this represents 6 months of work for one person. So these are, and none of you have 6 months solid of time to be working on one project. So we know these take a lot more time, and we know that there are always, little gaps and whatnot in things that happen. But that is why these are big projects. So I just really like to emphasize that because sometimes it just gets overlooked and people kind of think they can, get one out in like a month or two. So we know that's not true. So let's begin at the beginning. This is the best place. So project planning. I think it consists of a lot of unsung labor, but the more time and the more robust the planning and collaboration at the very beginning, the smoother the rest of the project will run, theoretically. So right at the beginning, we assemble our team. So you get to be right there. You are the researcher. I really hope to be right beside you as the librarian supporting you and helping you. You probably have a couple reviewers on board. They may be grad students. Maybe you even have another reviewer. And depending on what you're looking to do, you maybe bring a statistician on board, or maybe one of your reviewers or you is really adept at that. I encourage you, if you are doing cross-disciplinary research or that you're going to be touching on something in another discipline, that you utilize HRI Connect to maybe consider bringing on another research partner. A lot of you I know are doing this kind of cross-disciplinary research. Health touches on everything, and so we're often looking at the land, the climate, agriculture, history, communication, rural and urban populations. So definitely encourage you to reach out and look and find other partners to co-lead your project. I'm going to put in a plug for partnering with librarians, and it doesn't have to be me, but there are subject specialist librarians who you could consider reaching out through the library and seeking their advice as well. Key evidence synthesis organizations like Cochrane and CIHR have highlighted the importance of librarian expertise in developing search strategies and guidance throughout the process, as it reduces the bias and it just increases the transparency and reproducibility of your search and your process. You're going to hear reproducibility, transparency, all that quite a lot through this. So project planning, this isn't news to you. You know what's involved here. These are all of the things, but not all of the things, but it's a good list of what needs to be done before you even really get started. And the Knowledge Synthesis Center can help with a few of these. Obviously you're likely preparing your grant proposal, you're refining your question, you're considering the criteria for article inclusion for those articles that you want to bring forward to synthesize. You're identifying key papers that you know are on target and you want to make sure get captured in that search. And then you're building your preliminary search. You're considering where to search, and maybe at this point you're already developing and looking at registering your protocol for your work. So the Knowledge Synthesis Center, we can assist with respect to your grant proposal. If you're partnering us or collaborating with us, it's a possibility that we can write a letter in support to just to demonstrate that connection. It's just something to be discussed. Bring us on board if you want to do that. It's just a good opportunity. We can assist, I can assist as a librarian with that preliminary search strategy. And it's a really important step that I will say gets missed in a lot of projects at all levels, like right from the master student level up to the more advanced, faculty research type projects. You have to ensure your work isn't redundant or nearly redundant. So you want to make sure that there isn't a paper already written on what you want to do, or that there isn't already a synthesis covering your topic. I have experienced this previously with someone, and it's a bit heartbreaking to tell them that, oh, actually, as we're building your search and you've already decided to do this, that there is a paper written like 4 years ago on your topic, and so we need to change. Likewise, you also need to make sure that there is adequate evidence for review. I've experienced this as well. If you're looking at something that's particularly rare or not well researched, there just might not be enough evidence to synthesize, in which case it's possibly not the right path to move down. Um, and then, sometimes we have to look at, is your question too broad or too narrow or all that? So just those are areas that the Knowledge Synthesis Center and the librarian can really help you with. It can also help you make sure that you're doing the right review for the question that you're asking. Moving on. I have a bit of a bias here because this is the building a search. So I'm going to define that this is a key phase in the process. This is the start of your data collection process. This is a highly rigorous process, very important. So database searching needs to be a lot of things, and there's a lot of work that goes into that. It needs to be structured and it needs to be reproducible. So we have these characteristics where we talk about reproducibility, transparency, again. We do this across multiple databases because that decreases bias. And we're trying to be as comprehensive and exhaustive as possible. We're not just looking to find some of the research on this topic, we're looking to find all of the research that may be on this topic. And we meet these characteristics by creating a search strategy that uses subject headings, those are controlled vocabulary terms, and keywords and key phrases. We save that search strategy and we take it across multiple databases and we save it at each point. So we have a record of everything that we did. We keep track of everything that we did. And in some cases, we keep track of words that we tried and why we used or didn't use them. We keep track of all of the limits that we applied. If we have language limits, if we have date limits, if we have, other geographic limits, whatever, we keep track of every single thing that we do. By creating this big, comprehensive, exhaustive list, we are capturing everything. So it is quite big, and sometimes we end up with several thousand, and I'm sorry, sometimes many, many thousand results that we're going to have to move forward with. But just want to emphasize, everything you do here, you need to record and keep a record of, whether you're working with us or you're doing this for your own publication. It's very important. So there are two other ways, at least, of finding all of the research on your topic. The first one is citation chaining, and you're likely familiar with this. It's just everyone kind of uses different terminology for it. But when we talk about citation chaining, we're talking about finding one of those key articles or an article that we've come across that is really important in our research that we may or may not be using with our synthesis, but we're like, this really touches on the topic. And so when we do our backward chaining, we take a look at the reference list. So if that article was written in 2010, our reference list will show us the research that was done on that topic prior to that. So it will have all of the research prior to 2010. But this forward chaining piece is one that I find often gets missed. And that's where you're trying to look at the research that is written after 2010 that may reference that article because it may also be on topic. And you can use Google Scholar to do that. You can also use Web of Science, and many of the databases will have a little link that will say cited by, and that will let you chain your citations so that you can find more research on that topic that may be relevant. Gray literature. So this is information produced outside of traditional publishing channels. And so this can include government reports, newsletters, speeches, white papers, all of that. Oftentimes for an integrative review in healthcare, we're looking at things like clinical practice guidelines and other summaries of evidence, reflective of a certain practice. So I've created this and I've put this annoying little red circle around journal databases for a reason. You must do a structured database search in order to do a systematic scoping, integrative, rapid review. It is the key component to doing it. And I say this because not everyone recognizes that, but doing it in any other way is the equivalent of not randomizing a randomized control trial. It's the core concept to what you're doing. So you must create that search and run it at least across a few databases. It's very, very important. Citation chaining, also very important, and you really do need to do that. Gray literature, there are sometimes some rationale for why you wouldn't do it if it just isn't reflective of your topic, perhaps. Then you could, with reason, consider not doing gray literature. But strongly, like this first one, must emphasize, and then strongly recommend citation chaining as well. But if you are just gathering articles and using Google Scholar and maybe doing some citation chaining, you're just writing a literature review. And there's nothing wrong with writing a literature review. It sometimes is the best method for a topic. And I would so much rather read a well-written literature review than a poorly executed scoping review. But just bear in mind, the methodology is there for a reason. And so in order to do that scoping review, systematic review, et cetera, you follow the methodology. Likewise, the other thing I would put in here, just because it's becoming more and more prevalent, don't recommend using a lot of the AI tools like Research Rabbit and whatnot when it comes to doing your searching. Just simply because they're not necessarily transparent and their algorithms will change, so it makes them not reproducible. So if you do use them, you definitely want to state that you used them and state the date that you used them. But just bear in mind that you decrease the reproducibility of what you do by using them. I know they're really fun though, but they're not the best for this type of a synthesis. So looking at this stage and thinking about where the Knowledge Synthesis Center can assist you, a lot of what we've just been talking about, I hope you think of your librarian anyway when you think of those things, but we can definitely, when we're doing a collaboration where we're talking about like co-authorship and whatnot, then me as the librarian, I'm providing, guidance as to the databases that we're searching. We're drafting a search strategy and we're piloting it to make sure that we're actually capturing evidence that is appropriate to your topic, working with the principal investigator on this and often your research associate. I'm undertaking those searches, I'm recording everything that is done, and I'm extracting all of those references and getting them ready to move on to the next stage of screening. If you're just looking for a consultation model, which is totally okay, and I do that with a number of partners, then I'm perhaps reviewing your search strategy, maybe offering some suggestions. I might be creating, maybe helping you just create like a rough framework for a search strategy where you can fill in keywords and phrases as you come across them. But there's lots of guidance that can be provided there if this big collaboration model is just not something that you're interested in. So there's lots of work that can be done. Moving on. This is another part of the methodology that actually has pretty strict guidelines. So selecting studies to include in their review, otherwise known as the screening process. So all of the articles that you retrieved in the previous phase of your search, they move forward into this screening process. So if we found 5,000 articles in our search, then we're going to screen 5,000 articles. So the screening is a minimum of 2 steps. Your level 1 is the title and abstract screening, and your level 2 is the full text screening. I know some of you do much more complicated multi-level screening, and that can sometimes just depend on the specific outputs that you have, and that's fine, but it is that minimum of 2 stages. Level 1 is just a yes or no. So that's the title abstract screening. That's really just trying to weed out the obvious no's and the ones that you can just tell you like this is not appropriate or not used. Maybe it's the wrong type of article. You don't want an opinion piece or an editorial. And another good example that I find happens often is some of our search terms can be a bit confounding. So we end up pulling in a lot of off-topic research. And so a good example of that is if I was doing something around nursing education, and I'm looking for how we educate nurses, for example, nursing is going to possibly pull in stuff on nursing moms. So breastfeeding information. And I'm going to say that's an exclusion criteria that I don't want to deal with information about breastfeeding. We're looking at education. So that's just one of those examples where like that's a quick title and abstract screen where we're getting rid of that. And there's a lot of different stuff that comes up where you'll be like, nope, 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 nope. It's fairly quick. It's about 60 seconds per title. Level 2 is full text. And it's much more detailed. You are reading the article up to the point that you can definitively include or exclude it using your eligibility criteria. And we're going to address this in a little bit. At this stage, you need to keep track of your reasons for exclusion. When you're doing that first stage, that title and abstract screening, it's just yes or no. You don't need to rationalize why you did it. You don't need to keep track of anything. At this stage, if you are saying nope, you have to state why. Either it doesn't include the intervention in the way you need it to be, perhaps it's the wrong setting, perhaps the population is wrong, maybe it doesn't include a specific concept in the way that you want it to, or the article type is just wrong, but you need to keep track of those. At both levels, you are using a minimum of 2 screeners. And they should be working independently of each other and blind to the other one's decisions. And then any article included after the full text screening will move on to the next stage, which is quality appraisal and data extraction. But we'll get there shortly. So I talked a little bit about inclusion exclusion, or I kind of mentioned it. So going through the screening process here, we're going to think all the way back to our project planning phase when we started to talk about what types of articles we wanted to include in our review. So this is an example, and I use this in classrooms a lot. This is an example of if your research question or topic is around looking at a video game intervention to improve balance in a post-stroke population. So your inclusion criteria is going to be around, I've made ones up here, but I basically said, I want this intervention has been initiated less than 6 months from the stroke event. I want these to be non-hemorrhagic strokes. I want my population to be over 65 years of age at the time of the event of their stroke. I want them to be outpatient at this time. I'm going to use English language articles only, which I don't really recommend, but it's something I had put in here, so I should have taken it out. And then I only want randomized control trials. Exclusion criteria is technically anything else. So, but we've listed them out here because we're trying to be, have some clarity into what we want. And these really should be quite detailed. This is very short and kind of broad, and this is a very simplistic topic, so it's not really that challenging. But I have done research with a lot of you, and your topics are not so straightforward. So in a lot of cases, the detail that you need around inclusion and exclusion needs to be a little bit more robust. So the more detail that you can provide here, the better informed your team is, and the more streamlined the screening process will be, and the less conflicts you will have during the process. And I would just stress, this is one of those things that can kind of be challenging because people say, I don't know, like, how do I articulate what I'm looking for? And one of the best ways to do that is look through some of the papers as the principal investigator, and when you look at them, whether you want to include them or exclude them, and why you want to exclude them. So you need to articulate that and put it in writing. So if you look at it and you're like, well, the concept isn't defined enough. Well, what isn't defined enough about it? Why is it not? How can you articulate that so that a screener can read other articles and make that same determination? So you're really looking at creating guidance so that you avoid a big mess of conflicts at the end of the screening process, because all of those conflicts need to be reconciled, and it's probably going to be on you to be involved in that reconciliation process. So the less conflicts, the better. So you need to provide some really robust guidance as to inclusion and exclusion criteria. And you have to report on all of this in your paper. So the more detailed you are, the better it will be for peer review. I want to talk a little bit about software. There are evidence screening softwares out there. They're very good at streamlining the process. They allow for multiple reviewers to blindly screen articles. They keep track of all of that, of who screened what. Reduces the bias because then, reviewer 1 is not seeing what reviewer 2 has done and vice versa. It keeps track of all of your numbers for you. The Health Research Institute, we have an institutional distiller license. So if it's something that you're interested in using, you can pay to get added to it so that you can run your project through that. And distiller has a lot of customization. So we can customize pretty much any step of the way, and all of your forms can be customized for any information that you're looking to address during the screening process, and then also during that data extraction process. There's almost too much customization, but there's a lot that's there, and it is very handy. And a lot of our researchers really like using it. So I do recommend, if you're going to be doing a large review, software will really help you with the process. So as I said, Distiller and other softwares will keep track of the numbers that you are getting through your process. So you have that initial how many articles you pulled out of the databases. Some of them were deduplicated, and Distiller will do your deduplication for you. So if you've pulled something from Medline and then it's also in that CINAHL, it'll recognize that and it'll remove one of those records. It'll keep track of how many were screened, how many were excluded, and then again down here for your full text screening, and then you set the reasons for why you excluded them, and it just reports them all for you. So it's very, very handy for that. If you are doing a systematic scoping, integrative review, rapid review, you do have to report or submit a Prisma flow diagram that reports those numbers. So it's a pain to keep track of them. So I do recommend, again, with the software, it does it for you. So it's really a lot easier that it does that. So recommend that for sure. And just with respect to how the Knowledge Synthesis Center can support you through this, so both a research assistant or myself, we can provide that basic distiller support, getting you set up. I can help you with uploading your articles, the deduplication process, the basics of form setup. I'm finding a lot of research assistants or research associates out there are already actually quite adept with distiller. Some of you are experts in setting up some really complicated things, which is fantastic. And some of you are a little bit newer to it and need a little bit more guidance, and that's great. We try and help as best we can. There's also a lot of support offered through the software team themselves, so we can reach out for support when we really have questions about things. As a librarian, I can really provide a lot of guidance around the screening process. When I've worked with teams before, they'll have questions about like, well, how does this conflict resolution process work? Or what is it that we're supposed to do with this? How granular do we need to get with exclusions? What is the best way? All of that. And we can kind of work together to develop the best thing. A research assistant can be brought on if you just need a second screener and you don't have that person on your team, for example, and you're willing to pay for some hours for that. Then we can facilitate that. And our research assistants, will also have that same understanding of being able to just help you with the setup of Distiller. So those are both possibilities that are there. It is on you and your team to help onboard the research assistant to the project and to understand the inclusion-exclusion criteria. I'm always happy to teach them, what the screening process is and understanding the difference between level 1 and level 2 and how this all feeds in. But when it comes to the actual meat of your project and making sure that they're, including and excluding the right things, they need that guidance from the team so that they can do that in the correct way to support you. So moving into charting the data, at the end of your screening process, so if we took that 5,000 articles, hopefully not, that we got from the search, we ran it through the screening process, and maybe now we have, let's say we've been really good and we're down to, maybe like 30 articles. So those are the papers. That's the set of papers that you are moving forward with for appraisal and data extraction. So if you're doing a systematic review, you would likely be performing a quality appraisal or risk of bias assessment on articles prior to data extraction. A good chunk of the reviews that we do here are scoping reviews, so that quality appraisal isn't actually required. So I haven't addressed quality appraisal in here other than to just mention it. If you have questions about quality appraisal or you need tools or you're interested in more information on that, you can reach out to me directly and I'm happy to help you with however that can work with your project, because there's a few different ones out there, just depending on what it is that you're looking for. So the data extraction phase itself tends to be very individualized, and it's going to depend on what you're looking to get out of those articles to compare. And you can use the software for this as well, Distiller. You can, create forms, or you can also just do this on an Excel spreadsheet if, like, you're old school like me, then you might find it easier to just create a chart and plug in information there. But Distiller allows everyone to use the same form, and it just allows it to be all added into one place. And then it can just be quite easy in that way. It really streamlines it. You can be very granular. It's really up to you how much detail you want to put in there. Best practice for this stage is actually that 2 people per article are extracting data and that is reconciled at the end. I do not find that often happens in practice, but what will happen is that maybe 2 or 3 people will get together and do 1 or 2 data extractions on one article simultaneously, or that they'll do it separately and then come together and then they'll kind of pilot the process and then go off and do their own set of articles. Um, just interesting. I find it so awkward to do that and come together and reconcile, but that actually is the best practice. But it's a big undertaking, and this is what is giving you the information that you're going to use to write your paper. So you definitely want to make sure that you are doing high quality data extraction, and again, being very clear with your team members as to what they should be pulling out of each article. And this is, just to highlight again that the research assistant can assist with this. I, as the librarian, can certainly help you and offer some information, but it usually is also very specific to what you, the researcher, are looking for. But a research assistant can help with some of that data extraction, or maybe they can just help you with organizing the information or creating the form to extract in Distiller. It is still a manual process. I just want to point that out in Distiller. It doesn't automate anything. You do go through each article and grab the information yourself. So at the end of your data extraction phase, you have now extracted your data from, say, those 30 articles. You now have your data set. And many researchers doing these kind of projects don't recognize that they have generated data through this process. But I really want to highlight that your data includes, at a minimum, a search strategy, files of database downloads, a resulting set of papers for inclusion in synthesis, possibly quality appraisal forms for each paper, a data extraction table, and also a Prisma flow diagram, to say the least. So this is just my little nudge for you to look into proper research data management practices. The library does have a guide on that topic. I'm not just saying this because the research data librarian happens to be here. I had done this already, but I really do just want to highlight that oftentimes people just see this as like, I'm just getting information and spitting it out. I'm not creating anything, but you have created data, and that data needs to be protected. And then this way you also have it. If someone asks you to prove what you did, you have that data. This is your raw data. However, moving on. Into summarizing and synthesizing, I'm going to say a lot of you are already experts at this. You're very adept at the next two stages. So there's not a huge amount of detail going forward for these. So that's summarizing and synthesizing. It's compiling like in tables, grabbing themes, perhaps doing some statistical analysis, really starting to look at making those connections. Again, a research assistant or, grad students can help with this process. But at this stage, you're also really creating your framework and structure for your actual synthesis. And I would say that if you've had a research assistant, especially through, either it's your own or through ours, if they're moving through this process, we might be advocating that they also receive some kind of authorship on your paper because they've been heavily involved and they probably want to help with writing it up as well. So I would just bear that in mind, that a research assistant or associate can be involved in that from the center as well. Writing it up, reporting. This is what you do. Like I said, this is putting it all together. Really just want to highlight that if you are collaborating with the Knowledge Services Center librarian, then I'm drafting at least your methods section. I'm providing all of your search strategies and all of the detail that goes with them, and I'm creating your Prisma diagram and probably helping you with proofreading the rest of the paper. So it does become that collaborative process, and that's just how that part of that relationship works. And then, so I did say I would provide some resources and some links. And so that's what we have here. So I think these slides will be made available either on the website or through email. I don't think we've really sorted all that out yet, but I would say the Health Research Institute, if you're looking to find us and you don't know where the website is, if you just type in, you can Google search it, UNBC space HRI, I think we're the first one that comes up. And from that Health Research Institute, you can access a link to the Knowledge Synthesis Center, and you can get my contact information there, or just the general knowledge synthesis email there. I mentioned the library. There's a lot of great resources on the library, and I do recommend accessing your subject specialist librarian through that. If we're working together and we're touching on a subject, that we're working with as well, and it's something I'm less familiar with, I'm probably going to reach out to another subject librarian to get guidance. So I do recommend you do that as well. There's two guides there that you'll definitely want to check out. One being the knowledge synthesis guide. It's got fairly detailed steps towards writing a knowledge synthesis, all of the different things to do, and in a lot of cases, a lot of detail about how to do it. Likewise, the research data management guide, lots of great information on proper data storage. And also if you're looking to perhaps put your data in a place where it can be shared, there's some guidance there as well. And then that's my email down at the bottom. And you are always welcome to email me with any questions or comments, or if there's something you want to see in terms of like, oh, it'd be really great if you could offer like a webinar on this specific topic, like something around maybe discussing the screening process in more detail, then please feel free to reach out. All of these are very searchable on the UNBC website, so they are easy to find. But I do want to take just another quick minute of this just to really highlight the HRI Connect platform. So this is an initiative that's it's launched in the last year. It's really cool. It's a place, and you can use this QR code to get there. You can also get to HRI Connect from the HRI website. There's a little box there underneath the menu. But you can enter in your information, and this allows you to connect with other researchers. So as a faculty member or as a researcher, you can put your information and interests there, and it allows other researchers to find you. We do have a lot of exciting kind of initiatives and thoughts about where this could go, all in time because it is very new, but mainly it will allow for that greater connection. It's also what we're going to be using for, I believe, a lot of like targeted emails so that we're not spamming you with everything. And maybe if we have something specific to an area of interest with you, we're just reaching out to you specifically. As a student, I'm going to strongly recommend that you create a profile on here, because if some of us are looking for research assistants or we're looking for students to be involved on projects or to get hired onto projects, this is such a great way for us to grab a list of grad students and send an email to them. So this is an easy connection for you, and it's a great way to see and find faculty members and what they're researching all in one like little place. So I really strongly recommend you add your information to this. And that's kind of the end of what I'm going to talk about here. I'm just going to check the chat and see if I've missed anything. I know Sarah Gray is here as well. And so I know she has some comments. I will encourage you, you can pop questions into the chat while she's talking. And then if I'm able to address them after, I can certainly do that. But I just want to make sure that she gets time to speak.
Thanks, Terri. That was fantastic. I really learned a lot, but I just want to say that I just really love the way that you're able to explain that in such a clear and effective way, and also with your enthusiasm. I think sometimes these, particularly the really big, rigorous knowledge synthesis projects like a scoping review, are actually quite intimidating. And just the way you talked about it in a stepwise process, and where you're working with other experts on your team to support the areas that maybe are new to you. It just felt like a really great process, and that you're really a very approachable person to help. So we're just so thrilled to have you on our team at the HRI and the Knowledge Synthesis Center. And I just want to thank you so much for taking the time to do this presentation today. I also really appreciate your offer to the audience today to just identify any areas of specific interest that might be good for future webinars put on by the HRI. We're really myself and Trina Fife co-lead the HRI, and we're really wanting, the health researchers across the UNBC community. We know that health researchers exist in all of the 5 faculties and the division. And we really want the Knowledge Synthesis Center to be a resource for faculty at the various stages of their career, and when they're, when they feel most that the knowledge synthesis is something that they can be doing to move ahead their programs of research. And so, just a huge thank you to you, Terri. You did part of my job for me today, because you've been advertising some of the things that we're really trying to move forward with the HRI. Again, Terry's got her slide up here for the HRI Connect. Really was a wonderful project that Waqar Haque and his team really championed for the HRI. It was a huge number of student hours that went into generating this custom design portal for the HRI membership, because we had some leadership council members couple of years ago really say, I'm not really sure what it means to be a member of the HRI, and how would I really connect with people. And so his response to that was developing this database where researchers could, where it would be our membership database. It also, when you go in right away, it describes very clearly what our 3 levels of membership are, what the responsibilities are about being a member, which is actually pretty minimal. It's just being engaged and receiving a few emails about what we're doing. And of course, we encourage our members to come to things like our annual general meeting, et cetera. And then also some of the services that the HRI can provide for you as a health researcher. So I think I'll stop there because I think it would be really great if we could use the last 10 minutes just to answer any questions that the audience might have. So I'll just maybe pause there. Are there any questions for Terri just based on what she's talked about today? Maybe what I can do is I can just start. I know I have the advantage if I actually get to speak up here, but Terri, I'm just going to start with a question. You talked a lot today about scoping reviews and sort of more detailed synthesis projects. Are you also available to faculty to help them to understand sort of what level of knowledge synthesis they need to be embarking on based on their questions? So whether or not it needs to be or should be a scoping review, or whether it's, sort of a literature expert type review, is that the kind of thing that you can provide advice on?
Absolutely. And that can be a discussion like up front when you're in that, hopefully in that pre-planning process. It's always unfortunate when it comes up a little bit later. But yeah, definitely a discussion. There's also tools like if you want more, some people really like to go through and use the like what review is right for you. And that offers a lot of really great questions and can kind of help trigger better ideas about what might be a better project. But yeah, I'm happy to have those conversations with people because a lot of times we do find people are choosing scoping review because it's such a great methodology. But I'm like, gosh, that's not a scoping review question. So really good to have that conversation and really important to be thinking about doing the right review so that you aren't just following a methodology that maybe won't get you where you want to go. And like I said, I would so much rather read a well-written literature review than a poorly written scoping review.
So just in follow up to that, Terri, we have a question in there just as what exactly is a scoping review in terms of like a definition compared to other types of review? And I know you provided a lot of detail here, but can you summarize a little bit for someone if just as sort of a first step?
Yeah, for sure. So a scoping review is really just trying to find this, like broadly, the scope of something. So a good example of that is, and I can use this with medicine is always the easiest one to use. But if we want to see like what are the interventions out there that are available to a patient with MS who, to help them with their balance. So we can say, what is the scope of treatment available? So we're just looking to see the lay of the land, what is out there. So we're going to search for all of the different kind of treatment interventions that are available for treating that outcome in that population. And we would contrast that with something like a systematic review on a similar topic where we would say, how does the intervention of some kind of swimming exercise intervention compare with, say, a strength land-based intervention, and how does that impact balance? And is one of them have greater efficacy than the other? So it's just, again, based on the type of question that you are asking, and that's where having that conversation up front. Yeah. And I will say sometimes it's not straightforward, and we really sit and we'll have conversations amongst librarians and we'll be, gosh, is that scoping or is that systematic review? And just because there are way more methodologies than what I have mentioned here, because each one of these has a whole variety of confusing subtypes as well. And I think they've identified, and Trina can correct me on this, but it's something like 20 different review methodologies. Like, it's absolutely ridiculous. Yeah, so sitting down and having those conversations definitely valuable because it is not black and white. There's a lot of gray area there. Yeah.
Okay, thanks, Terri. That's great. So yeah, and I think this really speaks to the fact that you're bringing a real expertise around the methodology. We are our experts in our own sort of discipline area of health research. And so you're bringing that expertise in the methodology. And that's really the resource that the HRI, through the collaboration between the HRI and the library, that's what we were really trying to bring to this position. And so, just again, Terri, we're so pleased to have you join the team so that you can provide this kind of support for our researchers here at UNBC as well as our partners. Are there any other questions? We still have 5 minutes of time. I'll just pause a little bit.
Can I
Trina, yeah.
Yeah, I tried to answer some of the questions as they were coming through the chat, but
Oh, great. Okay.
um, Terry, I don't know if you could maybe just talk a little bit more about accessing distiller and sort of what that looks like,
Yeah.
because we use the term internet institutional license, but it's not in the same way as say we license our resources in the library.
You are correct, and I could have been a little clearer about that for sure. So we provide a fee-based access. So we're trying to do a bit of cost recovery with Distiller because it's an expensive tool and it has limited access. So we provide it. I think it's like $100 per month, like per project. So you can have multiple team members on that project, but it comes out of your basically your grant pays for it, and then you would have to create a contract with HRI to do that. And part of that is then that we also support you through that process. So you're not just given the access and that you have to go figure it out. We will help you with that. But yeah, there is a fee involved with it. And as Trina mentioned, we are investigating other opportunities or other methods of doing that because we recognize that there are limitations around that. But it is, I will say, if you are doing a very big project and you have a lot of analysis with a lot of layers, you might want to consider like really finding the funds to use it because it is I think it's the most robust evidence synthesis tool on the market. And it's Canadian, which is great. It's
Okay.
Ottawa based. Yeah.
Thanks, here. Yeah, thanks for that, Trina. I think that's an important message that some of the programs, including the distiller software for the Knowledge Synthesis Center, as well as, for example, grad student time or research associate time, as we spoke about, is really how the HRI helps to support researchers at UNBC, but also do it in a to generate a little bit of cost recovery. So we sort of do the upfront costs of distiller for the year. And then when we do have users of distiller, we do have these fees, which we hope feel reasonable for researchers to use them so that we can do a little bit of cost recovery. And every year at our annual general meeting, we do present to our membership sort of what our cost recovery was compared to our outlay so that we can assess the services that we are offering and keep the ones that are most useful to our faculty. So thanks for that.
Yeah.
Okay, any other questions? If not, it's 1:57 and I'm sure you people are off to their next thing at 2. So I just please everybody join me in thanking Terri for putting on this webinar today. And please reach out to the HRI and individuals that you'll see on the screen here. Terri McKellar, of course, Leanna Garraway and Bree Loeffler, who is our amazing admin team at the HRI. So if you have questions about knowledge synthesis, please reach out and we'd be happy to support you.
Great. Thank you
Thank you
so
so
much,
much.
everyone. It was really
Thanks,
lovely.
Terri.
Yeah. Okay. Look forward to hearing from you.